So my name is Austin Campbell. I'm an FSCJ student for the nursing program, ADN program. I'm going to be doing a simple IV insertion here with a 20 gauge. So I checked my MAR and I went over with the patient what's getting ready to happen and checked allergies and all that fun stuff. And so let's go ahead and get started. I have primed my tubing, my INT. I have primed my INT. And I'm going to be inserting a 20 gauge catheter needle, and I have my syringe as well. So I'm going to go ahead and talk to the patient, put my hand on the patient. I'm going to go ahead and do hand hygiene and apply my gloves. Alright, the patient, I've already done patient teaching and already talked about what to expect and teaching what's about to happen. So I have gone and I found the needle, or the vein that I want to use. It's nice and bouncy, and it's at the most distal part of the hand, and it's on their non-dominant hand. Okay, so I have found where I want to place my needle. I'm going to go ahead and apply the tourniquet 4 to 6 inches above the site that I've chosen. Okay, so I have my 20 gauge needle. I'm going to pull the skin tight. And I'm going to bevel up 15 degrees, loosen up my catheter here just a little bit. Okay, you're going to feel a little pinch. 1, 2, and 3. Okay, now I'm going to hold pressure above it, and I'm going to discard this using the one-handed technique and discard this into a sharps box. I'm going to take the sharp box and I'm going to dispose of that when it's 2/3 full. So I'm holding pressure on here. I'm going to apply my INT. Okay. I'm going to pop my tourniquet. Okay. And now I'm going to make sure that this is open. My little blue dooley right here. Before I do that, I'm going to take alcohol and clean the top of this, and I'm going to flush it. I'm going to aspirate just a tiny bit, and then I'm going to flush it with 3 mLs using the push stop method. Okay, do you feel any tenderness? Is that okay? Does that hurt? Okay, so that's good. Okay, so I got flashback as well. So I'm going to go ahead and apply a sterile, transparent dressing to this. And on that, I'm going to label the time, date, the catheter size, the length, and my initials. So that's going to be on here, and it's going to be secured. And I'm going to document the time, date, insertion, the gauge, the size, the type of the catheter, the number of attempts, the client's response, and the teaching that I taught the patient. I'm going to leave, and I'm going to come back and check on the patient. And I'm going to assess the site for any type of phlebitis or inflammation. And that's it.